Doctor, I was recently diagnosed with diabetes. I read online that high triglycerides increase the risk of heart attacks and strokes. Is that true?
Yes, that's correct. Triglycerides are a type of fat used by the body for energy, but high levels can increase the risk of heart disease and stroke. For diabetes patients, managing triglycerides is just as important as controlling blood sugar.
I see, that's worrying. By the way, you run a YouTube channel, right?
Yes, that's right. On my YouTube channel, I provide information about diabetes and other lifestyle diseases. We offer advice on diet and exercise, as well as tips for maintaining healthy habits.
Thank you. I'll subscribe and click the like button right away. There are many videos, I'll be sure to watch them.
Thank you. Since you've been diagnosed with diabetes, do you have any thoughts on what might have contributed to it, such as your diet or exercise habits?
Yes, I think my eating habits might have been a problem. I often ate fast food and sweets, and I didn't exercise much. I was also told my triglycerides were high. Doctor, am I going to have a heart attack or a stroke? What should I do specifically?
It's understandable to be worried. In today's video, I'll introduce 7 ways to lower triglycerides.
Thank you. But first, what exactly are triglycerides and how are they related to diabetes?
Triglycerides are a type of fat used by the body for energy. The fats you consume in your diet are converted into triglycerides and either used for energy or stored in fat cells. However, high triglyceride levels increase the risk of arteriosclerosis. For diabetes patients, high triglycerides are known to increase the risk of heart attack and stroke.
I see. I really want to lower my triglycerides. Can you tell me how?
The first way to lower triglycerides is to avoid excessive intake of carbohydrates.
What does it mean to avoid excessive carbohydrate intake?
Managing carbohydrate intake is crucial for lowering triglycerides. For example, limit foods like white rice, bread, and sugary processed foods. These are quickly absorbed and raise blood sugar levels, which can lead to increased triglycerides.
I understand. Is there anything else I should be careful about?
Yes, choosing foods rich in fiber is also important. Incorporate whole grain bread, mixed grains, vegetables, and fruits into your diet. These slow the absorption of carbohydrates and prevent rapid blood sugar spikes. Overall, focus on the quality and quantity of carbohydrates, and aim for a balanced diet.
Thank you. I'll try to eat less white rice, bread, and noodles.
The second way to lower triglycerides is to limit the intake of sweets and sugary drinks that contain simple sugars like fructose.
What does it mean to limit simple sugars?
Simple sugars like fructose are found in many sweets and sugary drinks. These are quickly absorbed by the body, causing rapid blood sugar spikes and increasing triglycerides.
So what foods should I avoid?
Limit processed sweets, juices, and sodas that are high in sugar. Instead, choose natural sweet foods like fruits, but even then, be mindful of portion sizes.
Thank you. I'll cut back on sweets and sugary drinks.
The third way to lower triglycerides is to reduce your intake of unhealthy saturated fats, which should be less than 7% of your daily energy intake.
What are saturated fats and why should I reduce them?
Saturated fats are mainly found in animal products and can increase triglycerides. They are abundant in red meat, butter, and cheese. Excessive intake of these fats is known to increase the risk of heart attacks and strokes.
How can I reduce my intake of saturated fats?
Avoid fatty cuts of meat and choose plant-based proteins like fish, tofu, and soy products. Use plant oils for cooking and reduce the use of animal fats. These changes can help keep saturated fat intake below 7% of your daily energy intake.
Thank you. I'll try to avoid butter and fatty meats.
The fourth way to lower triglycerides is to avoid trans fats.
What are trans fats and where are they found?
Trans fats are found in some processed foods, especially margarine, shortening, certain snack foods, and fast foods. These fats increase the risk of cardiovascular disease and contribute to higher triglyceride levels.
How can I avoid trans fats?
Reduce your intake of processed foods and fast foods, and focus on cooking with natural ingredients. Check food labels to ensure there are no trans fats. Use plant oils that are low in trans fats when cooking.
What are some healthy oils to use?
Oils rich in omega-3 fatty acids are recommended. These include fish oil, flaxseed oil, and chia seeds. These oils help reduce the risk of heart disease and improve triglyceride levels.
Thank you. I'll avoid foods high in trans fats.
The fifth way to lower triglycerides is to limit excessive alcohol consumption.
I know drinking too much alcohol isn't good for me, but I sometimes overdo it.
Alcohol can increase triglyceride levels, so it's important to limit your intake. When processed in the liver, alcohol can lead to higher triglycerides.
Should I limit my drinking? How much is okay?
Generally, men should limit to 2 standard drinks per day and women to 1. This is roughly equivalent to 2 medium-sized glasses of beer or 1 to 2 glasses of wine. However, as a diabetes patient, you need to be particularly cautious. Adjust your alcohol intake while prioritizing blood sugar control.
Is there anything I should be careful about when drinking?
Avoid drinking on an empty stomach and drink with meals. Choose alcoholic beverages that are lower in sugar. For more tips, watch our video on drinking alcohol wisely.
Thank you. I'll be mindful of my alcohol intake.
The sixth way to lower triglycerides is to engage in 150 minutes of active walking or other exercises per week.
I've heard exercise can help lower triglycerides. What specific exercises are good?
Aerobic exercises are particularly effective. Aim for a total of 150 minutes of walking per week, which means about 20 to 30 minutes of brisk walking daily. This helps burn fat and directly reduces triglycerides.
What should I do on rainy days when I can't go outside?
Indoor exercises are also effective. Activities like stair climbing, stationary biking, yoga, and stretching at home can help lower triglycerides. The key is to stay active regularly.
Thank you. I'm not very good at exercising, but I'll start with what I can do.
The seventh way to lower triglycerides is to maintain a healthy weight.
Weight management is important for lowering triglycerides. What should I do specifically?
Maintaining a healthy weight is crucial for controlling triglycerides. Focus on a balanced diet and regular exercise. For example, eat a diet rich in vegetables and limit excessive carbohydrates and high-calorie foods. Managing stress is also important, as it can lead to overeating.
So I need to be mindful of my diet, exercise, and stress management. Thank you.
Today, I introduced 7 ways to lower triglycerides.
Can you summarize everything we talked about today? I'm still worried, but I really want to lower my triglycerides.
Of course. To lower triglycerides, first, avoid excessive carbohydrate intake and limit sweets and sugary drinks. Second, reduce your intake of saturated fats found in animal products and trans fats found in processed foods. Third, limit alcohol consumption. Fourth, engage in 150 minutes of active exercise per week. Finally, maintain a healthy weight through a balanced diet and regular exercise.
How do I maintain a healthy weight?
A balanced diet and regular exercise are key. Focus on vegetable-rich meals and avoid high-calorie foods. Additionally, manage stress and ensure adequate sleep. Integrating these habits will effectively lower triglycerides.
I understand. I'll try to improve my lifestyle.
That's the best approach. Maintaining healthy habits is the most effective way to lower triglycerides. If you have any questions, feel free to ask.